Neil Patterson is home in Corner Brook this morning, a rarity. He's punched 80 hours a week on average, not including all the paperwork after hours.
It's a lot. I'm tired, I'm exhausted, but you get used to it over time. I think medical school and residency, in a sense, prepares you for this.
Patterson is a family doctor in Stephenville who also works as a hospitalist and covers the emergency room. He is from Ontario, came to Newfoundland for residency training and loved it here. He decided to sign a 2-year contract as a full-time doctor.
And the government had lots of initiatives and bonuses and incentives for the recruitment and retention of family doctors in the area. And so I'd signed on to avail of those. A lot of people may not be aware, but there's a lot of years and financial investment involved with becoming a physician. So I have 10 years of post-secondary education, and many physicians actually have more years of education, and that's expensive. Most physicians in Canada graduate hundreds of thousands of dollars in debt. And so I was quite eager to avail of these bonuses and try to make a dent in my student loans.
Patterson was actively recruited with the promise of several government bonus incentives. Number 1, a 1-year $100,000 bonus for serving in the community. 2, $75,000 for being a part of the family care team in Stephenville. 3, $5,000 to relocate, and 4, a raise after working for 1 year. He hasn't received a dime. He's inquired multiple times about the bonuses, getting sporadic mixed messages from NL Health Services that say he is not classified as a full-time physician with the family care team because of his time in the emergency room and hospital.
The same people who are denying me these incentives are the same people that are asking me to cover in the hospital when needed. And I can only be in one place at a time, and sometimes you have to make the decision of where would be the most important to be during your day.
Newfoundland and Labrador Health Services advised Patterson to not speak to the media about his situation. He felt exhausted and desperate and decided to speak out anyway. After multiple requests, NL Health Services would not do an interview with CBC. After the story went public, a spokesperson issued a 1-line statement saying they don't comment on doctors' benefits or salaries.
All these family practitioners have a choice how they want.
Patterson feels the government doesn't care about family doctors. He's had to involve his own lawyer and the legal team with the Medical Association, who say the government's recruitment and retention efforts are failing, and rural areas are at a risk of falling apart.
It's one thing to attract them here. It's one thing to keep them here. And if people are meeting frustrations and beating their head against a wall, they are not going to stay. If they don't feel valued, if they don't feel respected, if they don't feel like they're wanted, they're not going to stay. And no matter what job you do, if you don't feel those things, you're not going to stay.
At the family care clinic in Stephenville, he says 4 doctors have resigned in the past 3 months. And as for Patterson, well, he would love to have an apology from the health authority. And of course, he would love to receive these bonuses that he was promised to help pay off his student debt. But at this point, he doesn't think either one of these things will happen. Colleen, CBC News, Corner Brook.